You may have heard the term transitional object mentioned and wondered what a transitional object is. Well, it's something that the baby associates with being merged with the mum and the comfort and soothing that comes from being with mother, and it serves a bridge to a state of increased separateness and an increased capacity to self-soothe. Usually, a transitional object develops out of the baby's most pleasurable moments, which are of being fed and of being held safely and securely while being fed. So they may be to do with sucking, a thumb, a dummy, a little bit of a blanket. But a real transitional object comes usually only towards the end of the first year, and it has to do with the baby's increased capacity and need to manage being alone, particularly around bedtime, at times when mum may not be immediately responsive or immediately available. A transitional object is experienced by the baby as a first possession and a first not me possession. And if you're wondering which of the things that your baby seems to be attached to is likely to be his or her transitional object, it's the one that you daren't go on holiday without, the one that you're worried about losing because you don't have a replacement, or the one that eventually you're too scared to wash because it is so close to disintegrating. Because most transitional objects develop out of positive associations of being close and secure in mum's arms, we aren't surprised that they're dummies and bottles. But very often, it's something about the texture or the tactile softness of an object that becomes appealing to a baby, because it's associated with being caressed, being stroked, being snuggled. So a baby may choose a blanket, perhaps the blanket he or she is most often held in or covered with, or a soft toy. And sometimes it's the label on either one of those two things that is particularly appealing. The seeking and the finding of a transitional object is part of an infant's endeavour to increase separation and increased individuation. It's about trying to find something that is not mother and not me, but associated to mother and belonging to me. It connects mum to baby when baby is away from her. Sometimes you'll notice that it's not an object that your child seems to have adopted as a transitional phenomenon. It can be an activity. Some babies will hum or sing to themselves or rock, and that may well have been because there's an association to a caregiver who sang and or rocked the baby at times of distress. Does your baby need a transitional object? Well, a transitional object is something that happens quite typically in normal and natural development. We all need to become more self-regulatory, and we all need to manage or find ways of bridging the gap between being one with mum, which is what the first 3 months of primary maternal preoccupation is really about, to becoming more individuated. Technically, this is a psychological and a developmental process that involves the taking in from the outside positive experiences of being soothed, being comforted, feeling secure, so that eventually the locus for self-regulation and self-soothing is internal, but it's based on external experiences that have been accumulated over time. And a transitional object helps this process to develop. This is part of the process of developing a secure sense of self. Should you be introducing a transitional object to your baby, most mothers quite naturally offer something to help a baby who seems to be soothed by sucking but isn't needing to be fed, something to suck on, like a dummy. But a dummy is not really a transitional object while it's serving a sucking purpose, or while it's serving the purpose of extending the sucking. It becomes a transitional object because it's the thing that the baby has easily accessible. Sometimes that will also transfer at a later point to a bottle, particularly once a child can hold his or her own bottle. Mothers recognize that children need something comfortable at night and will often tuck a baby in with a special soft toy, or will start to notice that a baby prefers a particular blanket and use that one when the baby is being put to sleep. It's most particularly at bedtime that you will find children seeking out and needing their special transitional object. I do want to alert mums who think that a dummy is a good transitional object to think or to be a bit mindful about when and why you give a dummy, because giving a baby a dummy to shut a baby up, to stop the kind of noisy process that may be important communications, is not helping a child in terms of a transitional object, and may well in fact be something that you regret much later. I don't think that it's about trying to introduce something. I think it's rather about being sensitive to what may naturally be happening, because ultimately it's going to make separating easier if a child does have a transitional object to call his or her own. A baby will choose his own transitional object because it has meaning for him. Sometimes you'll figure out the meaning. Maybe that the blanket or soft terry cloth that you used for feeding has got a particularly strong smell of you, and that's what's comforting. Or it may be the toy in her cot that she was most easily able to reach for. But a baby will imbue his or her transitional object with its own meaning, so you can't really choose it for them. The journey from birth to maturity is really a journey of increased separateness. Babies are going to move from a state of complete and utter dependence on a caregiver to being required to, as adults, self-regulate all aspects of being human and of living. And transitional objects serve a very useful purpose in those early stages of separation, being able to manage going to bed and sleeping alone, being able to manage playing without being held in the arms of somebody, being helped to cope with transitions to school, play dates, and so on. So when does a baby stop needing, or a small child stop needing, a transitional object? Again, this is one of those things that you can't really dictate and or even determine. Children are going to do this when they are ready, and that's going to be influenced by the kinds of situations they're expected to cope with and their own particular temperament. And I guess as well on the accumulative good experiences they have had at being reassured and being comforted. So dentists and speech therapists don't like dummies for fairly obvious reasons. They change the shape of the palate, and they often interfere with speech development, or certainly with verbal communication. And it gets a bit risky if you send your child, or if your child insists on going off to school with his favourite teddy. Schools don't really want to take responsibility for such precious possessions. So it may well be that you feel, or the environment feels, that the transitional object needs to be relinquished more than your child would naturally agree to. How do you do it? Gradually. It's like weaning. It's a loss. It's about letting go. And it's usually helpful if you can encourage your child to play an active role in that, rather than just passively submitting to a forceful removal. Sometimes you will realize that your child has become very attached to a bunny and you daren't risk losing it, or a particular blanket that you don't have a second of. And you may well frantically rush around trying to find a substitute or a replacement, either for when it's in the wash or, heaven forbid, because you lose it. Even if you do lose the original one, a child is going to take some getting used to and may not even accept a substitute. It's traumatic. It's a loss. That's what a child is having to manage if their transitional object suddenly disappears. They're going to work through all the stages of grief, and there will be some mourning and some regression, and you may have to be a punch bag for some very angry feelings too, for not having safeguarded this possession that was so hugely important and precious. So your child hopefully will gradually wean herself from depending as much on her transitional object as she gets older compared to when she was smaller. It's going to be done bit by bit, and sometimes it's even done bite by bite. Sometimes transitional objects are not let go of, they're actively destroyed, and that's okay too. Does your child need a transitional object? My sense is that if she does, she will find one, and it would be helpful if you can support her in that. If she doesn't need one, she may well never really attach to anything in particular. Perhaps the thing to pay attention to, though, is if your child does really not want to relinquish whatever it is that they're particularly attached to, maybe even it feels as though they're addicted to it, at a time when all around you it seems that other children are managing without their transitional objects, then that's an invitation to think about what may be going on around separation and possible separation anxieties. Are there stresses in the home? Is there a new baby? Is there something going on around a new adjustment? And that might require a little bit of thought and perhaps a new or creative response.